All right, let's get started. I'm Dr. Susan Marra. I'm a naturopathic doctor in Seattle, and this is my colleague, Alex Volchonok, who is a biological dentist in New York City and Greenwich, Connecticut. Alex went to undergrad at Lehigh. He did his dentistry in traditional dentistry at University of Pennsylvania, and he did his residency in periodontal and implantology at Columbia University. What sets Alex apart is that he went on to study on his own biological dentistry, and he really is the only biological periodontist and implantologist, I think, in the US. Is that correct?
Correct. Yeah.
And he went on and did what's called a quote unquote uh, maxi residency in biological dentistry, periodontal and implantology.
Yeah, correct. Actually, specifically in biologic dental surgery and cavitation surgery. So
Yeah,
things we
at
both talk
Tufts
about there. Correct.
University. It's a brand new program. You were in the first class, weren't you?
Correct. Yeah, in the
Yeah.
pioneering class. Yeah.
So Alex is really a pioneer, and I met him at the Global Lion Alliance. He was one of the speakers, and he and I completely connected, and we decided that we wanted to try and work together to promote the recognition of oral dysbiosis and oral um, illness in tick-borne illness and mycotoxin illness patients because it's rampant, and it takes the form of receding gums, dry mouth, jaw pain, cavitations, cavities, all kinds of TMJ issues, all kinds of different issues. And so Alex has come up with a four-pillar approach to identify some of the problems that arise when you have these chronic infections in your mouth. So I'm going to turn it over to Alex now, and he's going to talk about his ROSA program, ROSA.
Yeah, perfect. Thank you so much, Susan. I'm going to share the screen here. And I'm very excited to be together with everyone here for part two of our program. When we're talking about oral systemic health in Lyme disease patients and patients with chronic illness. And we're going to focus specifically on the benefits and the power of the ROSA screening. So part one, we really introduced concepts of the mouth and being awareness of and creating awareness of how disease in the mouth can create systemic health issues. Today, we're going to talk about how to diagnose and how we find out what is really going on. And then we will follow up with a part three, which is going to focus on the treatment modalities that we use to treat dental infections, specifically in patients with chronic illnesses and Lyme disease. So, Susan, thank you for having me. And I'll start off by talking about the four pillars of Tetrahealth. So, when we think about treating patients in a holistic approach, when we are looking beyond the mouth, when we are trying to connect everything together, um, we were thinking about what would be the right philosophy, what would be the right context to take care of patients properly. And we found that there are four pillars of health, which is why we named the practice Tetrahealth. The first pillar is the most important one for our conversation here, which is the oral systemic health pillar. And this is about identifying root causes of disease and focusing on treating and getting problems treated at the source. The second pillar is foundational health. This is eliminating toxicities and inflammation from the mouth and likewise from the body to help create a proper basis for future health and healing, and also to allow us to establish the proper functional health so the mouth can have optimized roles in digestion, in chewing, in speech, and making sure that everything is built one pillar onto the next. And obviously, importantly in dentistry, and many times we will think about the aesthetic health pillars. So making sure that all the work that we do at the end of the day looks great and is going to enhance the patient's confidence and self-image, which is really, really important. And let me see here if I can advance. One second. Since I am running the program solo, I'm going to have to bounce between admitting viewers and being able to advance slides. So pardon me if it takes a minute to do that. Yeah. So when we take all this together, we realize that patients with chronic conditions such as Lyme disease and tick-borne illnesses can be negatively influenced by oral inflammation and infections. And this is something that we talked a lot about during our first part. And anyone who has missed that, I recommend going back and seeing that part because it talks about that and sets the stage for it. But realize that biologic interventions are designed to eliminate disease at the source and support the mouth and body in achieving optimal health. This is how these four pillars come together and why it's so important to treat patients along this continuum of care and activate treatment modalities across all four pillars: oral, systemic, foundational, functional, and aesthetic health. To deep dive it a little bit further, if we look at the oral systemic health pillar, what is this about? And this is about treating the mouth and the body simultaneously, understanding that the mouth plays a critical role in overall systemic health and wellness. And we meticulously will assess and manage the conditions that we find in the mouth, aiming to identify the root cause of the disease process. We are not looking to just treat symptoms. We are looking to get to the very basis of what is going on with our patients. This means that we have to look even beyond the mouth to see what stressors are affecting the body. What is the patient's nutritional issues? Are there certain deficiencies? Are there certain excesses? What is going on with their systemic health? Are there other inflammatory conditions? Are there other diseases that are playing a role that can affect the health of the mouth and vice versa? We're going to talk about some of the ways that we can test for this, including salivary testing, which we're going to talk about that extensively today. And even other things like dental materials and dental biocompatibility testing. And to the point of what Dr. Marra and I do together, we look to create an integrative care model, meaning that we look to work very, very closely with each other and with other functional medicine practitioners to make sure that we have the right team of people around the patient so we can treat all the issues comprehensively with great communication and truly get to the root cause of the problem. Dentistry alone cannot solve it. Medicine alone cannot solve it, but together we stand a greater chance of being able to achieve a better outcome for our patients. Foundational health, that second pillar, is a continuation of that oral systemic journey. Once we have the oral systemic health in check and we have that controlled, we want to now focus on creating the proper oral environment. And that means eliminating toxicities and inflammation in the mouth so that the body can really focus its energy and efforts on other issues. For those patients who are suffering from Lyme disease or other chronic illnesses, being able to eliminate periodontal health issues, removing mercury or heavy metal toxicities from the body, treating airway or sleep apnea issues, or infected teeth or cavitations are important ways that dentistry, biologic dentistry specifically, can eliminate some of those burdens that cause toxicity in the body and challenge and stress the immune system from properly healing. There's only so much disease the body can manage at one time. I use the analogy of a bathtub being filled with multiple faucets at the same time. And if we have them all running together, it's very easy to quickly overflow that tub because there's only one spout to get things out. But if we could turn off the oral toxicities and the oral inflammation, that's now eliminating one major source, and the body can now focus its effort to drain disease from other parts of the body. As we move on to functional health, the mouth plays a very critical role in digestion, in airway and breathing, and the supportive structures of the jaw and the face. When we build a foundational health, we want to optimize those functional roles. This includes proper tooth alignment for not only bite and function, but also for airway, making sure that there's a nice wide arch of the upper jaw and also the base of the nose. Managing TMJ issues, joint pain, muscle pain issues that can be manifesting from a poor bite or poor occlusion, or possibly patients who clench or grind their teeth extensively. We also will focus on the replacement of missing teeth, utilizing the latest advancements in dental implant technology of zirconia implants to rehabilitate any missing teeth. And then focusing on a biomimetic or a biologic dentistry approach to rehabilitate teeth and restore the proper function of the mouth as a whole. And I just got to try to admit somebody here while we are continuing. 1 second. I apologize for the pauses that this creates, but every time someone comes in, it doesn't let me advance the slides. That final pillar, the aesthetic health pillar, right? At the pinnacle of health, and the reason why we want everything to come together is that we can see the patient's true beauty and true confidence of a vibrant smile and youthful face come together when we know we've built on this healthy foundation of the three previous pillars. And this is not something that we put in the forefront. I think it's very important for patients who are seeking optimal aesthetics to understand that you cannot achieve that if you have a rocky foundation, if you have inflammation and disease in the body. It ages you, it destroys the bone, it destroys the teeth. And we want to make sure that we focus on aesthetics, not by just putting a veneer over something or making it look good, but truly getting to the source of the issue so that we know that this is not only a beautiful smile, but something that is lasting, enhancing the confidence and self-image of a patient. And we have a lot of ways we can do that. Everything from biocompatible ceramic crowns and veneers to gentle tooth whitening procedures, gum augmentation and contouring procedures, and even extraoral therapies and treatments that are commonly done by my sister, Dr. Michelle Volchonok, laser facial rejuvenation, which is really, really amazing. With that in mind, with the concept of the four pillars in mind, I think it gives more understanding to one of the opening quotes that I shared and started part one with. And we're going to do a quick recap of that. And that's the quote from the former US Surgeon General, Everett Kopp. It said, "You are not healthy without good oral health." And that's a fundamental pillar that we come back to. And remember, we talked about the mouth and the body connection in part one. We talked about how the mouth is a gateway to the body where numerous commensal and pathogenic interactions take place, where good bacteria and bad bacteria are working within that same environment. And this is completely moderated by our immune system. When we have a healthy situation, the microbiome, the oral microbiome, promotes balance, homeostasis. And it's actually protective. It's going to compete for resources against pathogenic bacteria. However, when there's a shift in the microbiome, when bacteria shifts, we start to shift towards a disease state. We call this dysbiosis. And this creates a greater prevalence of these pathogenic bacteria, which create chronic inflammation and damage oral tissues, as well as distant organ sites as well. And we also will see an elevation in systemic inflammatory markers. And this axis between the mouth and the body is one that we constantly see in patients with dysregulation needing to be addressed in order for systemic health issues to be abated. And we talk about the mouth being a pathogen reservoir. And this is actually how we ended our previous program. And we talked about the oral environment offering several advantages to persistent pathogens, right? A few of the things that we find is that there's an environment in disease that is low in oxygen, what we call an anaerobic environment. This can exist within periodontal pockets or even within cavitation sites within the jawbone. We also learned that the biofilm is protective and it can make microbes resistant to antibiotics and immune attacks. This is why it's so difficult to manage this without a comprehensive approach. We can't just use a pill or expect a cleaning alone to be able to get rid of what's going on here. We also talked about the fact that disease states affect the blood supply to the gums and to the bone, and diseased bone sites and cavitation sites have poor blood supply. This makes it very difficult for medications such as an antibiotic to reach these areas and treat the pathogens. And so we need to take a complete approach when we deal with patients. And also understanding that there's a constant immune signaling that happens. Inflammatory signals are released from the infection site in the mouth, but travel via the bloodstream throughout the body as a whole. And this activates inflammatory receptors throughout the body in other organ systems, whether that's in the brain, in the heart, in the GI tract, all throughout, which creates this chronic systemic inflammatory response. And we see these conditions mirror exactly what we see in other chronic infection reservoirs, such as tick-borne diseases, when we see it in joints, in the nervous tissues, and in the connective tissues. So as we talked about Lyme disease, and this was an interesting thing that came up in our conversation, according to the research of what we're seeing, about 10 to 25% of patients with Lyme disease and associated co-infections struggle to achieve sustained remission despite antimicrobial therapy. And Dr. Marra even highlighted that that number is probably far short of what it really is. Patients have a really tough time getting through this, especially if there's other comorbidities in the equation here. And the mouth is a frequently overlooked area, but it can be a major source of persistent infection reservoirs. It's a warm, wet environment that is shielded from the immune system, which makes it ideal for these pathogens to preside there. But if we can treat the oral drivers of disease, we can often unlock progress in other parts of the body. And that's the saving grace here. This is the hope of what we want to achieve. And so I want to talk about, how do we identify these things? How do we detect this disease process? All right. And with that, I'm going to introduce the concept of the ROSA screening. But I first want to share, why is there a need for a novel diagnostic approach? And I will share a few things. I'll share the conventional way that we diagnose disease in most dental practices. Most dental practices will take a dental x-ray, like the image on the top, and hopefully they will do periodontal probings around the gum line to take a look for inflammation. But there's a fundamental issue here. Even though these are both considered the current gold standards for dental diagnostics, these are always identifying issues that have already happened, right? This is identifying diseases or damage that has already happened to the body and is often irreversible or hard to reverse once it gets to this stage. In the image on the right, we have a cavity that is extending, outlined by the yellow circle. We have a cavity that's extending all the way to the pulp of the tooth. Had this been detected earlier, had this been treated earlier, this tooth could have been saved. All right. In the image below, we see a periodontal pocket where the probe, the little metal probe, goes all the way down to the very base of the gum. We see bleeding and inflammation, and this tooth has severe periodontal disease, and often can also be a situation where this is a tooth that now needs to be lost. So we want to prevent that. And we should be able to predict disease and not wait for disease to manifest itself to begin treatment. And that's why we need to change our diagnostic approach. And it's the reason why we've developed the ROSA screening. So what is this? So the ROSA screening is a comprehensive health assessment that connects oral and systemic health. And it's consisted of 4 parts: radiographic, oral, salivary, and airway assessments. Taken together, that's why we call it the ROSA screening. So let's look at each one of these specifically first. Sorry, just trying to advance here. Okay. Yeah. So how can the ROSA screening help patients with Lyme disease and chronic illness? Well, Lyme disease, especially chronic or post-treatment Lyme, often leaves patients in a persistent inflammatory state, and oral inflammation can further exacerbate this problem. So we need to get better diagnostics to be able to uncover this so we can get patients with this condition treated sooner. It is the most comprehensive and diagnostic evaluation of oral health and has consistently led to earlier identification of infections. One of the things that we have found since we've implemented this protocol and we've developed this protocol is that we are not waiting for patients to manifest with disease process. We're not waiting for patients to inform us of pain and issues that they have, but we're able to identify this earlier, treat it earlier, and allow the body to focus on other health issues such as Lyme disease. It also allows for much more seamless collaboration with functional medicine practitioners. Dr. Marra and I often go back and forth and look at patients' data and patients' record, especially salivary testing, to talk about the things that we're finding and developing trends. Dr. Marra has been very helpful in identifying patients who have had unsuccessful outcomes and looking at things that are preventing those patients from getting better. Maybe there's other co-infections, maybe there's parasites, maybe there's mold. and making sure that we can really find plans to help patients with this. It also has allowed us to take a look at patients that have gone through various treatments and have hit a certain plateau where there's been an initial improvement in Lyme disease treatment, but then it stopped. And no matter what we do, we just can't get the patient better. And that's why the oral health component is so important to take a look at, right? And it allows us to focus on prevention, right? Which is the best treatment of all. So let's deep dive in each of these parts. So that first pillar of the ROSA screening, the radiographic component, involves upgrading from conventional two-dimensional X-rays to 3D CBCT imaging. We want to take a more comprehensive look at our patients, and 3D imaging allows us to see a whole lot more of what's going on with our patients. When it pertains to teeth, we can get very precise information about the depth of dental decay and understanding if we can remineralize a tooth, preventing treatment altogether, or what is the most predictable interceptive treatment we can do. We also often find lesions such as resorption, which are areas of root surfaces that are starting to dissolve or get eaten away by trauma or damage to the ligament of the tooth that conventional X-rays almost never catch. And this is one of the ways that teeth sometimes are lost, even when they're asymptomatic, meaning that this is not because of a cavity or because of a gum disease problem. And this is common in patients who are clenchers. This is common in patients who are grinders, patients with genetic susceptibility, and also patients with Lyme disease, which is why this is so important. It also helps us identify missed root canals. A lot of patients who've had a root canal therapy had it done with conventional 2D X-rays. And it's easy to miss a canal when that happens. And this leaves a place for bacteria and biofilm to preside. We also can look for fractures in teeth, missing or broken teeth. And that's just that level alone. And this is far more than even what conventional X-rays can tell us about teeth, but it goes beyond that. We can look at the bone and look at the extent of periodontal disease in a comprehensive three-dimensional view, 360 degrees around the tooth. We can look at cavitations, like in the image on the right, highlighted by the arrows, these empty spaces within the jawbone that we would never be able to identify with the conventional dental X-ray. And by the way, this is a common area where we find Lyme pathogens, parasites, mold, and other bacteria that the body cannot get rid of. We also can identify periapical infections, teeth that may appear normal in a 2D X-ray that actually have a much more significant disease process going on. And I'll talk more about that coming up. And then we can look at structures around the teeth and gum, the teeth and the bone, such as the sinuses, the airway spaces above the upper teeth that are often affected when there are dental issues. We can look at the salivary glands and look for salivary stones, obstructions, or occlusions. And we also can take a look at patient's airway, the back of the throat, to make sure that there are no constrictions or issues that can affect airway and breathing. And all this from a single scan that takes less than 30 seconds to do. The wealth of knowledge that we can have in this is really, really amazing. And it's one of the reasons why, as a standard of care in our practice, we ask all patients to either do a 3D scan prior to seeing us, or we will incorporate it as part of our initial visit process. And to deep dive why, for anyone that's still kind of questioning, is it worth doing it? Do we need to do it? I want to show a situation here of an X-ray on the left of the screen, which is a two-dimensional picture of two molar teeth. This image represents the exact same teeth as what we see on the 3D scan on the right side. And what you can see, which you never would be able to identify on the two-dimensional X-ray, is the extensive infections marked by the red arrows on the images on the right. These roots are chronically and severely infected to the point that the bone around those roots is being dissolved. And even in image C, you could see inflammation in the sinus. That upper arrow points to swelling and infection in the sinus that is coming off of the fact that bacteria is leaking out of this tooth, destroying the bone around it, and now permeating into the sinus. So this small structure, this small tooth in the mouth is creating this major, major issue in the patient's head. And conventional dental x-rays, two-dimensional x-rays, cannot properly identify this because you need to have 50% bone mineral loss on a conventional x-ray before you'd be able to see those changes. In fact, you'd only see it once the infection has perforated through one of the bone wall structures, usually the outer part of the jawbone. This results in a delay in diagnosis. And I see this all the time. I see all the time patients who have had dental x-rays taken, and then we'll take a 3D scan and they'll say, Doc, how long has this been going on? How long has this been here? And oftentimes this can be over 6 months. There can be a huge delay between when we could have diagnosed the disease had we taken a 3D scan and when I see them, especially when they've only had a two-dimensional x-ray. Going further, cavitations. I can almost guarantee you that most cavitations cannot be seen at all on a conventional 2D x-ray. And to the importance of our lecture here and the work that I do with Dr. Susan Marra, we look very extensively for cavitations as a sign of disease because this is a key area where we find Lyme disease. And we want to be able to rid the body of any sources where these pathogens can persist and reside. With conventional 2D x-rays, you cannot see this, and more importantly, you cannot plan the proper approach to treat it, which is what 3D images allow us to do, especially with the advent of some new technology called visiogenics, or visualization of the cavitation site, which gives us not only a mapping, a color mapping of where the cavitation is, in this case, the brown color on this cross-sectional view in the image all the way on the right, but also precise measurements of what the size of the cavitation is, how far it is from vital structures like the nerve, the yellow line across the images, and also a surgical plan, the red box. How do we best approach access to the cavitation in the most minimally invasive way? All right, because the treatment that we want to do, we want to be maximally effective, but minimally invasive. And this mapping and surgical planning is a really key tool for how we achieve this. Moving on to the comprehensive oral assessment, the oral exam in the ROSA screening, we want to take a look both at extraoral and intraoral structures. All right. In the intraoral side, not just the teeth and the gum, but also the soft tissues all around, screening for oral cancers, screening for occlusal issues like grinding, cracked teeth, vibration on teeth, and making sure patients have proper salivary production by palpating the salivary glands. Especially with age and over time, we see a decrease in the salivary production, which is one of the key markers we see prior to dental decay forming and periodontal disease forming. Outside of the mouth, we also want to examine the patient comprehensively for their TMJ joint and the disorders, and understanding if there's muscular or disc issues, looking for lymph nodes, which show signs of disease and show areas of involvement and inflammation, and looking at soft tissue lesions and facial aesthetics as well, which are important aspects of those original 4 pillars that we talked about. And to talk very closely about the S of the ROSA screening, the salivary markers of disease, the salivary testing. This is something that is really, really important. And I think one of the best advancements in periodontal health and treatment that I think is so heavily underutilized. We can now test a patient's microbiome and their genetic inflammatory risk simply from a salivary sample. As simple as spitting into a tube, we can extract millions and millions of species of bacteria and your own oral cells that we can understand what are some of the risk factors and what are the profiles that we have for oral disease. Not only can this be predictive for disease to come, but it's also a way that we can create a metric to see the effectiveness of the treatment that we've done. And if we run into any obstructions or obstacles, it helps us elucidate that there may be other things involved from the oral systemic health component that need to be treated so the body can get the microbiome in balance. So I want to look at that very closely. And if you look at the image on the upper left, that's called the MyPeriopath test. And this identifies specifically periodontal pathogens that are associated with oral systemic health diseases. The red pathogens, the higher risk pathogens, are the bacteria that are associated with disease, not just in the mouth, but with the body at large in a more expansive and extensive way. This can affect everything from the brain to the gut to the heart to metabolic control and to joint health. And these are very, very important bacteria to make sure that we can either decrease to a significant threshold or hopefully even to undetectable levels. It also helps us take a look at both low and moderate risk pathogens too, which are building blocks that shift that oral microbiome. In the first lecture, we talk about the shift from a healthy environment to a dysbiotic environment, and it's the shift in the microbiome that starts to facilitate that. So we want to eliminate a patient like this with these types of results. For example, we want to try to eliminate the detectable levels of these high-risk pathogens. We also can perform a test called Celsus-1. And this is a genetic screening for inflammatory disease risk in patients. We look at a patient's innate and acquired immune systems. Our innate immune systems is our natural patrolling mechanism. I tell patients this analogy of like the police. They're patrolling the body, making sure that everything's in order. They're not out there because there is something that's specifically wrong, but if there is something that comes up, they are the first signals that are activated. And if there is a moderate or high risk response, this can be indicative of a patient that is very, very sensitive to even a low or moderate risk bacterial profile, creating both oral and systemic inflammation. We also look at the acquired immune system. The acquired immune system is the trained immune system. I always like to say this is a little bit more like the SWAT team. So when this immune system is activated, they're kicking down the doors and they're making a big mess. There's a lot of collateral damage in the body that happens when the acquired immune system is activated. You look for things like interleukin-1 and interleukin-6, tumor necrosis factor alpha, matrix metalloproteases, which break down collagen tissues, not only in the mouth, but throughout the body as a whole. And if we see a higher prevalence of periodontal pathogens, more of these red and orange bacteria showing up on the MyPeriopath test, then we know that we're starting to activate that acquired immune system, especially the more chronic the condition is. So helping us understand your individual profile is a very important part of the decision-making process of how we treat the disease, and also what's the appropriate maintenance protocols to keep you healthy. And specifically for those who are here listening because of Lyme disease issues, there's a panel that's very, very helpful by a company called DNA Connections that we could run from either a salivary sample or a intra-surgical blood sample, meaning that at the time of surgery, like the surgery of a cavitation, we can sample the site and detect the pathogens that are there. The bar graph, the horizontal bar graph on the left side, takes a look at bacteria, viruses, and parasites. And we would run a secondary panel, the text on the right with the yellow highlights, which looks specifically at Lyme pathogens. And if we see some key findings, some check marks that show that there is DNA evidence of Lyme pathogens in that area, this is a key indicator, not only that we are eradicating that site of these pathogens of this disease, which is very, very helpful for anyone who has Lyme disease, but also we know that we're on the right track for the body. We are now taking off that burden. We are closing one more of those faucets of disease. So an up-close view of all these, we can kind of see how these things come together. And this is exactly what we want to be treating with our patients. All right, and taking a look at this. So these are the common salivary panels that we run for patients. We do make it specific depending on the health history and the things that are going on, but incorporating salivary testing, not only for initial diagnostics as part of the ROSA screening, but also at annual follow-ups. So usually 6 months to 1 year later, we will repeat the MyPeriopath test on patients to see what are the changes in the microbiome. And that's very actionable information because it allows us to know the efficacy of treatment and if the patient needs any further treatment or further intervention, or are they at a point where we can transition them to stability and maintenance protocols. And lastly, we'll talk about airway health. All right, airway health is a growing field in dentistry that is incredibly important because we know that conditions like obstructive sleep apnea are major factors that decrease the longevity and quality of life for patients. And as dentists, we have the opportunity to be firsthand at identifying some of these risk factors and also treating them. And we'll talk a little bit about the treatment in the next series, but for diagnostic aspects, we will do 3 common things during our initial airway assessment with patients to take a look at what's going on. First and foremost, we will ask the patient to open their mouth, say ah, and we will take a look at how patent or how open the back of the throat and airway is. And we call this a Malampati index. On the image on the right of that, you can see 4 classes. And what you'll notice in a class 1 patient, you will see the back of the throat and an open airway. Whereas in a class 4 patient, you only see the soft palate. And this obstruction of the soft tissues and the uvula, the little dangly structure in the middle of the throat, is an indication of airway obstruction, right? This can interfere with the ability for the patient to be able to breathe fully, and that's one of the things that we want to pick up. We also will do a screening questionnaire, something called the stop bang assessment, and we will ask patients about how they would answer yes or no to those following categories. Are they snoring? Are they tired during the day? Has anyone ever observed them choking in their sleep? Are they being treated for blood pressure? And then we'll look at some objective markers. If the BMI is over 35 kilograms per meter square, is a patient over 50 years old? Is the neck circumference over 40 centimeters? Males, greater predispositions. And there's a scoring rubric that we use to develop the risk factors. All right, and that helps us understand what's going on. If someone has a score greater than or equal to 5 on this category, this is considered a high-risk patient. Intermediate risk is if they're yes, they answer yes to 3 of the 4 categories here, and low risk if it's 0 to 2. And then to get more clinical data as the patient sleeps, we will send patients home with a sleep study. And we utilize a device called the WatchPat 1. It's a very comfortable device that goes on your wrist, a little bit like a smartwatch, and it connects to a pulse oximeter on the finger, just like on the picture on the left-hand side, and a little aspect that gets adhesively attached to the sternum of the chest to kind of listen to breathing. And this will record your sleep position, snoring, and most importantly, how many airway obstructive events happen during the night. This is going to take a look at pulse oximetry. So we're going to see how much oxygenation is in the blood. And when that drops below 3%, when it drops by 3%, we consider that an episode, an apnea hypoxia episode. And we will count how many times that will happen during the night. Patients that have an apnea hypoxia index over 5 are diagnosed with having obstructive sleep apnea. And there's 3 categories: mild, moderate, and severe, depending on how many episodes they have. All right. And so we want to make sure that a patient does not stop breathing in their sleep. All right. And I will tell you, ever since we've incorporated airway health screenings into our practice, we are identifying obstructive sleep apnea episodes or airway disturbance breathing at a much higher rate than patients were experiencing that before, when they would kind of bring their own symptoms to their functional medicine doctors, to their ENTs, or to their pulmonologists. And I think this is such an amazing opportunity for us to make a meaningful difference for our patients in detecting this very significant life-threatening disease prior to irreversible changes such as elevation of blood pressure, increased risk for stroke, and other cerebrovascular events. So in conclusion for this part, because I want to leave a little time for us to answer some questions if there are any, we want to talk about the disease. In disease, the mouth can function as a reservoir of chronic inflammation, and it can act as a barrier to full recovery. To deep dive that, go back to part one, listen to that, and you'll see some of the ways that happens. But fortunately, because of the ROSA screening, employing radiographic, oral, salivary, and airway assessments, we can now get the most comprehensive view of a patient's oral health and understand its effects on systemic wellness. So this goes far beyond just looking at disease in the mouth. We are looking at markers and issues that are happening in the mouth that have systemic ramifications. The mouth is truly becoming a window that we can look through the rest of the body. And by ensuring we do not miss root causes of disease, and by ensuring that we can identify disease and infection earlier, we're able to help the body better manage chronic illnesses, which is a fundamental aspect of what we are trying to achieve on the biologic dentistry side, and why we play such an important role as a team member with doctors like Dr. Marra and other functional medicine practitioners. And in conclusion, I want to share exactly the same point that we ended the last one with, which is that the mouth is not just where disease begins. It is also where healing can begin too. And with that said, I want to thank you for your time, for your attention. And I look forward to our third and final part when we're going to discuss some of the therapies and the treatments that are incorporated in this process. So thank you very much, Dr. Marra, for having me speak with your patients and with you on this. And happy to take any questions you may have. And anyone else, because we're doing this a little bit shorthanded, I will ask if you can please email us any questions, and I will get back to you with a response. Thank you.
Well, that was super interesting from the perspective of my perspective, because I can sense both in myself and in my patients, those people that hit a plateau. And I've checked for mycotoxins, I've checked for chemicals, I've checked their hormones, I've checked and checked and checked and checked. And the only thing that I haven't checked, obviously, because I don't know how, I don't have the skill set, is the oral microbiome. And so when I met Alex, I was like, oh, this is the missing piece. And so I've sent him, I don't know, probably 40 patients, and he's already found stuff. So not, I kind of knew he would, but my point is that what he's talking about with regards to the patients that I see that have multiple tick-borne illness, COVID, mycotoxin illness, trauma, there's definitely a oral microbiome piece going on. And I think what he said about the mouth being a reservoir for tick-borne illness organisms and mycotoxins is extremely important. Extremely important. And there's not a lot of lip service paid to this particular issue. In fact, you really don't hear about it at all. And yet I think it's prevalent in my guess is in the majority of my patients. But because there isn't this place of working together with a biological dentist, I mean, I think that he and I are some of the, rarer sort of pairings of professionals. I don't know, maybe I'm wrong. I could be. I
Yeah,
could be
no,
way
you're
off.
absolutely right.
That this whole area is being missed in our patients, which is why I can only get you so well, because there's something missing. And I've known this for a long time, but I didn't have anybody that I trusted. I'm very skittish about, sorry, Alex, but I'm very skittish about dentists. And the reason is that they can tell you anything. Oh yeah, you have 6 cavities. Oh yeah, you need this. Oh yeah. And you have no way to check.
Mhm.
And so, that then sends me, somebody like me, on a path of, 5 different dentists, and everybody says something different than the previous one. And so I have over the years learned to be sort of what, no, wait a minute, what are you doing here? So when I met Alex and I heard him speak and I could feel his integrity, I was like, okay, well, maybe we have a chance here with Alex. And so he and I have kind of been, beginning to develop a relationship. And because he and I are both learning as well along the way. Oh, wow, okay, you know, and so we're learning about the role that Lyme and Bartonella, and I'm not sure if Babesia plays a role, but I know Lyme and Bartonella play a huge role in the health of the oral microbiome. And I'm pretty sure that in cats, Bartonella, one of the manifestations in cats is, I believe it's called stomatitis.
Hmm.
Is that correct?
Yeah, correct, correct.
And so if Bartonella manifests in the mouth in cats who are mammals, it's most likely going to manifest in the mouth of human beings, which are also mammals. Just it's a leap of faith, but it's not a far leap. And I think that we're going to begin to identify these kinds of things. We're working to try and figure that out. So
Yeah.
I'm
And
I'm
and I'll just
grateful.
kind of quickly add one thing to what you said, Susan, that I think is so important because, I think, in the audience here we have probably some people that are patients of the practice already, and some patients and people who are, considering if that's the right fit. And I want to tell you that I think the most important thing is that we have to educate people, and the ROSA screening is designed to be an education tool. It's objective, it's test-based, it's doing labs, doing sleep studies, reviewing a 3D scan. And I think it's so important. Anyone who's been a patient in the practice can probably attest to this. I always want you to understand what's going on by showing you. We'll put the scan on the screen and I'll try to explain it in a way that's understandable. And I'll show you where the infections are. So I'll show you where the decay is. And the whole purpose of that is that we believe working with an educated, informed patient, you can be a better advocate for your health and your understanding of the challenges that we face to get you healthy, and you'll become a better partner. And that is the most important thing. I can't do this alone. I can't do this even in tandem with Dr. Marra alone. It really takes all three of us, right? You as a patient need to be involved in your healthcare journey and take ownership over the fact that we need to get ahead of the things that are going on here. And we all work as a team together to achieve that. Chronic illnesses, chronic infections, Lyme disease, these are hard, hard things for the body to get rid of. And we need to work together to address it at every possible source. And the mouth, fortunately, is one source that we can directly get to and make a very meaningful and lasting effect to do it. And that's why I think it's so important why Dr. Marr is talking about the fact that, we can create a pathway where if a patient starts to get stuck, if they can't get past something, we actually have this place to look at and we can get to the bottom of it. So I think it's been really great to put this information out there, to put this knowledge out there. I want to thank you, Dr. Marra, for inspiring me to do this and for working together with me on this. And again, please, anyone who has questions, who's interested in learning more, please email us info@mytetrahealth.com. If anyone is more on the social side, feel free to send us a message at mytetrahealth.com. And thank you all. I wish you all a wonderful, wonderful evening. Appreciate that. And we will do one more part of this. Dr. Mar, we have a date for that, right? That's going to be
Be the third. Oh, I don't have my. It's
yeah,
going
the
to be
third.
the third Thursday, which I think is it's going to be the third Thursday at 5 p.m. East Coast time, 2 p.m. Pacific time, and I'll make sure that you guys get the Zoom. And what we're trying to do is we're trying to set a foundation and spark an interest in the mouth body relationship and the mouth brain barrier. Alex hasn't even talked about that yet, but it's super interesting what he has to say about the mouth brain, right? The mouth is like very close to the brain, right?
Yeah,
We
yeah.
already know we've got leaky brain, we've got leaky gut, we probably have leaky gums, we have leaky mouth. I don't know.
Yeah, yeah. I mean, that's the other way to look at periodontal disease. It literally is the same thing as leaky gut. It's leaky gums. Yeah, I'll talk about that a little bit then on the next program. I actually am at the Integrative Health Symposium here in New York. So one of the things we've been talking about at the conference here is the corollaries between periodontal disease and Alzheimer's disease, which it happens through a breakdown of the blood-brain barrier. It starts to become loose and weak bacteria, pathogenic bacteria like P. gingivalis that we detect on the MyPeriopath test. We'll be able to kind of identify if that is at risk, if you're at risk of that developing and permeating into the brain, and the inflammatory markers that are elevated that actually open up those pathways and open up those channels where the blood-brain barrier is not as effective at excluding bacteria. So we'll talk about all that. And if anyone has specific questions about that, I'm more than happy to discuss it. But
Thank
you know,
you,
with that,
Alex.
wish you all a good night. Thank you very
Thank
much.
you, Alex. That was fabulous. Thank you all for showing, for coming. And I hope to see you next time. Good
Thank
night.
you. Thank you. Have a good night. Bye bye.